from KSL.
Good evening. Breaking news to get to. Utah's COVID numbers continue to climb, and that prompted an emergency alert statewide to cell phones. You probably got it, 26 minutes ago.
Right. Well, the governor will be speaking to residents right at 9:30. We'll have that live right here. So coming up in about 4 minutes.
Okay, let's go over to Kristen right now because the weather is the other big story today. Quite a bit of snow in some areas, huh, Kristen? Is because of the increase in hospitalizations today. Utah's Department of Health announcing 424 people currently hospitalized with the virus. Of the 424 people hospitalized, 170 of them are in the ICU. 78% of our ICU beds are full. Health officials also announcing 2,386 more Utahns diagnosed with the virus, pushing the state's 7-day average above 20% right now. Health officials also announcing one more Utahn has lost their life to the virus. A Tooele County man between 45 and 64 years old who was hospitalized at the time of his death. Stick around. We'll be right back with the governor.
Well, of course, we have been anxiously awaiting hearing from the governor. You got that announcement on your phones, but here we go. We have more now from the governor. Let's take a listen.
Good evening, fellow Utahns. As you know, we are in the midst of a serious pandemic. The number of infections in our state is growing at an alarming rate. Our hospitals in Utah are among the best in the world, but they cannot give the best care when hospitals are at capacity and medical professionals are exhausted and spread too thin. And that is what is happening now. In our war against COVID-19, we need our doctors and our nurses, and now they need us. They're pleading for our help. The stakes are high. Lives are at risk as COVID-19 cases surge, and we report record hospitalizations and new deaths day after day. Our hospitals are full. This threatens patients who rely on hospital care, from everything from COVID-19 to emergencies like heart attacks, strokes, surgeries, and trauma. We must work together to keep infections low until a vaccine is available. Therefore, tonight, I'm declaring a new state of emergency to address hospital overcrowding and to protect intensive care unit capacity. In conjunction with this order, let me share 4 critical announcements. First, because scientists and medical experts overwhelmingly recommend masks as an effective way to limit the spread of COVID-19, I am placing the entire state of Utah under a mask mandate until further notice. Businesses must require employees to wear masks and to promote mask wearing to their patrons and to visibly post signage to that effect. Those who fail to do so will be subject to fines from the Labor Commission. Masks do not negatively affect our economy, and wearing them is the easiest way to slow the spread of the virus. Experts tell us that masks do not cause a shortage of oxygen to your brain or cause disease. We cannot afford to debate this issue any longer. Individual freedom is certainly important, and it is our rule of law that protects that freedom. Laws are put in place to protect all of us. That's why we have traffic lights and speed limits and seat belts. And that's why we now have a mask mandate. Second, many of us are careful to exercise caution in public. And our health officials have found that such caution is paying off as the spread in these public and institutional spaces is minimal. So although we are relatively safe in institutional settings such as offices, stores, churches, etc., data tells us that we are most vulnerable to infection in casual social gatherings. It is crucial that we exercise more caution when socializing with those who do not live with us in our homes. Therefore, by order of my office and the Utah Department of Health, Utahns may not participate in or host casual social gatherings with individuals other than those in their immediate household for the next 2 weeks, which is the incubation period of COVID-19. Many of you will have questions about how to safely gather during the upcoming holidays. We will share with you recommendations and directives in the coming days. Furthermore, it should be known that we will not tolerate organizers of public gatherings that do not exercise the required precautions of social distancing and mask wearing. State and local authorities will prosecute and hold accountable those who sponsor and organize such events and gatherings. Organizers will be subject to fines of up to $10,000 per occurrence. Third, we do commend those students who want to participate in school sports and activities. However, because students who participate in activities outside the controlled school environment frequently get and spread COVID-19, we are therefore postponing for the next 2 weeks all sports and after-school activities, with the exception of high school playoff and championship games and also intercollegiate sports. This suspension includes club sports, city-sponsored sports, and intramural sports, as well as other club activities. This is a 2-week postponement that will enable us to immediately prioritize testing of student athletes involved in playoff and championship games and put in place a robust process of testing student athletes involved in other winter sports and activities. Testing of intercollegiate athletes is already occurring under the direction of their respective conferences. Furthermore, students should not gather in social groups outside of regular school hours during the next 2 weeks and must be very careful thereafter. Our data shows that individuals aged 15 to 24 have not been careful in their casual social gatherings, and that the highest rates of spread are now occurring among this age group. Fourth, during this 2-week period, our public health teams will significantly expand our testing operations. During this 2-week period and beyond, we will test more people who have symptoms, and we will also launch a targeted testing program for those who don't have symptoms. This will begin with weekly testing for our university students and expand to include high school students who participate in extracurricular activities, people in the workplace under the age of 35, and our high school teachers. We will also expand the role of our National Guard in testing and contact tracing. Now, let me be clear. What I have shared with you this evening is not a shutdown of our society or our economy. We're not closing any businesses. Our health experts, in fact, agree that a full economic shutdown is not necessary nor warranted to slow the spread of COVID-19, but that the wearing of masks and exercising every precaution when it comes to gathering with others, including social distancing, is crucial. Utah is open for business. You can still shop, dine in, or carry out, exercise, worship, and recreate, and many other things. We are just saying stay within your household group whenever possible, particularly for the next 2 weeks. Also, there's more that you can do. For example, you can get your flu shot. Our hospitals have now started treating the first influenza cases of the season. And by getting a flu shot, you can save critical hospital space for others. Finally, I know it is easy to become discouraged. We've lost 659 Utahns to this cruel virus. Too many have lost jobs and worry about how to pay for food and housing. Too many feel isolated and alone. Simple actions can make a critical difference. So let's find ways through technology and other means to help each other through this difficult time. If your needs are immediate and critical, please call 211. We must all remain vigilant until a vaccine is widely available, but we cannot wait upon a vaccine knowing the havoc that this pandemic has wreaked on families, schools, and businesses. We must do more, and we must do it now. That is why I've issued these critical orders and mandates. But there is no legislation or executive order that can mandate civility, respect, and basic consideration for others. This is about so much more than just mandates. This is about personal responsibility. In this month of Thanksgiving and gratitude, I'm grateful for you, my fellow Utahns, my neighbors, and my friends. I've seen you do remarkable things in my 11 and a half years as governor. I've seen our state face extraordinary challenges and overcome great adversity. I ask you now, and I implore you, to do everything within your power to stop the spread of this disease. The day will come when we won't have to wear masks or social distance, when we'll be able to see everyone we love and care about and give hugs and handshakes without worrying about unknowingly spreading this disease. I hope this day will come sooner rather than later. In the past, when we have had natural disasters, we have all come together to give assistance to our neighbors, sacrificing whatever we can to help them out. This crisis is no different. It is time for the divisiveness to end and for all of us as Utahns to unite in making whatever sacrifices are necessary to help our neighbor and to bring healing back to our state. I know that we can and that we will prevail as we all make the small sacrifices necessary to save many lives and protect our health. May God bless us in this effort. May God bless you, May God continue to bless the great state of Utah. Thank you and good night.
Listening there to Governor Gary Herbert, and kind of sensed last week that something like this was likely going to happen. You could sense the frustration as he spoke last week, especially with the numbers increasing and specifically those hospitalizations.
Right. The ICU beds right now, the numbers are not where health officials want us to be. They're hoping for the next 2 weeks, if we follow these guidelines, that we can get back to a more safe number, something before what we saw in the last week. So
to quickly recap here, Governor Herbert's new declaration of emergency there, it comes with some of these new restrictions.
Yeah, first, a statewide mask mandate. All Utahns must wear masks in public and within 6 feet of anyone that you don't live with. It will be enforceable, Governor Herbert says, and businesses that fail to comply will be subject to steep fines.
And the declaration also limits casual social gatherings to households only until the 23rd of November. Extracurricular activities are also canceled for the next couple of weeks, with exceptions to intercollegiate events and high school championship games. The state of emergency also increasing testing and contact tracing, and it provides more specifics about how the state is going to do that.
News specialist Tanya Dean has been following the new state of emergency and focusing on this testing. So, Tanya, a big change here.
Yeah, Mike and Ashley, health officials say they'll be targeting 15 to 35-year-olds. That age group has more potential of spreading COVID-19 without even knowing they have the virus. That means mandatory testing will go into effect for college students, some high school students, and potentially in the workforce. State officials plan to get a lot of tests and resources from the federal government. Their goal is to get as many people tested as possible and find those that are asymptomatic.
So the idea here is to go out and test as many individuals as we possibly can and find out who these people are in terms of who these silent spreaders are, and essentially remove them from the transmission pool by isolating them throughout the course of their infectious period.
So who will be tested first? Health officials say college students and some high schoolers. Now, Mike will tell you exactly how they plan to go about it coming up in a few minutes at 10 o'clock.
Looking forward to that. Tanya Dean live in the newsroom tonight. Tanya, thank you. And coming up in our 10 o'clock newscast as well, Governor-elect Spencer Cox will join us live to talk more about this new state of emergency. We have quite a few questions for him. I know he'll answer them, and it'll be interesting to get his take on as he will be the next governor here, and this will be passed on to him. All right, the weather, another big story today. Coming up next, a few duck hunters become stuck in today's snowstorm, how they became lost.
And we look back at the life of Jeopardy host Alex Trebek, how he's being remembered tonight.